In this on-demand tutorial, we will be reviewing recognizing scoring bias within the CANS. For any SACWIS CANS concerns, please contact Rob Herquest at dcfs.cansuse@illinois.gov or robert.herquest@northwestern.edu. When recognizing scoring biases, it's important to understand the 5 types of biases. Cognitive bias is a deviation from standards of judgment. A person may create inferences, assessments, or perceptions that are unreasonable. There could be a recollection of past experiences that are incorrect. Prejudice are prejudgments or prior opinions that a person makes before they are given the relevant facts and information. Often these are based on factors such as race, religion, gender, sexual orientation, age, disability, social class, or language. Contextual bias. This is when experts who have good intentions are vulnerable to making incorrect decisions based on external influences or influences that are irrelevant or unrelated to the situation. Racial profiling and victim blaming are both examples of common contextual biases. Unconscious or implicit bias is stereotypes, and when a person is unconsciously attributing certain qualities to certain social groups. Statistical bias is related to the process of data collection. Examples include forecast bias, observer expectancy effect, selection bias, reporting bias, and social desirability bias. Scoring the CANS well, accurate reflection of the needs and strengths of the family, requires use of your professional skills and experiences. However, it also requires that you are mindful of dynamics that may bias your scoring of certain items. Your experiences or connections to a youth or caregiver may make it difficult to remove biases when scoring an item. You may have a fantastic relationship with a caregiver and do not want to give them a bad score that may somehow reflect negatively on them. Remember, the CANS is not a judgment on the children or their caregivers, but rather a tool that is used to identify needs that should be addressed. We also see the opposite of this. If you do not have a good relationship with a caregiver, it may be tempting to score them more harshly. It's important to recognize these biases and to refer to the manual for levels. Additionally, we oftentimes see biases against fathers, and when this happens, they may be scored more harshly. Previous case exposure and outcomes can create biases. You may have been influenced by having been involved with a family that was very similar, and it resulted in a difficult outcome for the family. There have been instances when caseworkers that have been part of returning children to homes of families, only for that child to be harmed again. The cumulative impact of these cases impact how items are scored. Our own personal experiences and upbringings can cause us to have biases. If you have personally experienced DV or grew up in a home where there was DV, you may find it difficult to remove your own personal feelings when scoring items related to DV. Are you working with a 6-year-old child survivor of sexual abuse and you have a 6-year-old child at home? This may also create biases in scoring items. We all grow up within cultures, and that culture can shape what we consider to be normal. Different cultures view things such as discipline differently. If you grew up within a culture where spanking with a belt was a normal form of discipline, you may have biases when scoring items related to discipline. The CANS culture we are exposed to can create scoring issues. Supervisor or office attitudes towards the CANS may create biases. How much value we find in the CANS can create biases. Do you find the CANS to be meaningful or practical use of data? You may not want to leave a note. All of these things can create biases when scoring the CANS. In the next slides, we will review some examples. You are not aware of a youth having any religious involvement, and they have not expressed any spirituality beliefs to you. You do not feel that they should be getting a low mark because of their lack of spirituality, so you score number 27, spiritual religious, a 0. Is this scoring bias or not scoring bias? This is a form of scoring bias. Remember, 2 and 3 in the strengths domain does not equate to a negative to a youth or that there is something wrong. It only means that that item is not currently a strength for the youth and we are not going to focus on it. Remember, CANS scores are not a judgment of the person, but should accurately reflect a need or a strength. Your experiences or connections to a youth or caregiver may make it difficult to remove biases when scoring an item. A youth has a stable relationship with parents, but recently the parents were divorced. The child now lives with their mother and only visits dad on the weekends. Because the youth still has a relationship with both parents and it is very stable until the divorce, you score 0 on 29 relationship permanence. Is this a scoring bias or not a scoring bias? This is a form of scoring bias. Even though the youth is still in contact with both parents and there is a history of stability, there has now been instability in the relationship due to the parents' divorce and dad living in a separate home. The best way to ensure your personal biases are not influencing your rating is to refer to your manual. You learn from a mom she often argues with her partner, but she tells you it never occurs in front of the children. You yourself grew up in a home that experienced DV, and you are concerned the mom is not telling the truth. You score item number 99, marital partner violence in the home, a 3. Is this a form of scoring bias or not scoring bias? This is also a form of scoring bias. In this case, a 1 would be appropriate until you can gather more concrete evidence that the arguments are happening in front of the child or putting the child at a greater risk. Your supervisor tells you it's okay to score item 0 if there's no services available in your area for a particular need a youth may have. They tell you that it doesn't matter because no one really looks at the CAN scores anyway. Is this a form of scoring bias or not scoring bias? This is a form of scoring bias. If any agency or team does not find value in the CANs or understand the meaningful use of the CANs, they may find it is easier to score all 0s and 1s and not have to leave a note. You have not been able to meet with a dad who lives separately from the family. You feel he's not made any effort and mark him a 2 on most caregiver items. Is this a form of scoring bias or not scoring bias? This is a form of scoring bias. You should be scoring a caregiver based on evidence of a concern. Thank you. If you have any questions or concerns, please reach out to Shannon Kroll, Emma Breen, or Robert Herquest.